Good morning, good afternoon, and good evening, everyone. Today, the 323rd session of International Forum for Promotion of Homeopathy's continuous Zoom session. Before starting procedures, let us have a silent prayer for 1 minute. Okay. Today, on 20th July 2021, our chief guest is Dr.Santosh Ranade from India. Is MD Homeopathy, MA History and Philosophy, Assistant Professor of Physiology, Department of APES Homeopathy Medical College, Kolhapur. Written scientific papers in homeopathic management of COVID-19 using Fer.Phos 30. This topic is homeopathic management of COVID-19 using Fer.Phos 30. So, on behalf of IFPH and Dr. Manoj from Trivandrum, Kerala, India, welcoming you, sir. You can proceed. Thank you.
Thank you, sir. First of all, I'm very thankful to International Forum for Promotion in Homeopathy for asking me to join this session. I'm very happy, and a special thanks to Dr. Shivang Swaminarayan. Before starting my topic, the efficiency of homeopathic medicine Fer.Phos in the management of COVID-19. When before 1.5 years, when the pandemic began, me and my two best friends, Dr. Makaran and Dr. Sagar, we have discussion that this pandemic is going to affect on a large scale. So the basic idea we are having that we have to develop one tool that could be very easily available for each and every doctor and healthcare practitioner or healthcare provider or even a nurse who can give the benefit of homeopathy to a common man. Because when there is a large scale pandemic, there is a risk of collapse of healthcare system. We had experienced that. And the point since beginning, our vision was very clear that we want to develop one tool that could be very useful to homeopath and from the modern medicine or Ayurveda or any healthcare provider. So we have taken the study since beginning, and our program was objective to treat the COVID patient at home for reducing the load on hospital or healthcare system. We know we have the potential in homeopathy to treat this sort of disease on a large scale. And we know that the hospitals are overwhelming, oxygen and all other facilities are becoming scanty or not available to the each and every people. So the objective of our study was to treat the patient at a home and to reduce the burden on the hospital system. So the process we have developed some tools. We are not going in detail of that. Now the question comes, why we selected Fer.Phos? Straightway we will come to the topic that many people get an eye that only Fer.Phos, what you are doing, what you are using. Now, as we all know that homeopathy is based on similia similibus curantus. Now the question comes that what is mean by symptom similarity? We all know that the science is based on individualization. But in case of pandemic of COVID-19, we can say similarity on pathological level. Now we had come with a unique concept of pathological similarity. It is already explained by Boger. And if you refer the Douglas Borland's pneumonia, this idea you can see well developed by these peoples. For the action of homeopathic remedy, it is mandatory that drug pathology to be matched with disease pathology. Now, in this light, we can understand Fer.Phos much better as a specific remedy for COVID. Now, let's first understand what is novel coronavirus. Initially, we understand it as a flu. People say it's a kind of a flu, but it is much more than flu. It's postulated that the beta chain of hemoglobin and the porphyrin are separated by structural and some non-structural proteins of novel coronavirus, which causes reduction in oxygen carrying capacity of blood. It also affects the coagulation process, leading to thrombosis and immune coagulation. We had seen a picture like DIC rarely in H1N1 pandemic. This virus causes vasculitis and in severe cases cytokine storm. Now all we people knows this. Does the Fer.Phos pathology matches this? Yes. The basic manifestation of hypoxia is a weakness. Now we know, if you read Fer.Phos from Kent lecture on Mater Medica, you come across the first word, great weakness. Someone might say that there are thousands of remedies for great weakness, but if you look in a pathology, weakness due to reduced oxygen carrying capacity, then you can come prominent remedy as a Fer.Phos. Fer.Phos is well known for years to improve the oxygen carrying capacity. Now, does Fer.Phos trigger intracellular signaling pathway, making repair of beta chain of hemoglobin? We are working on that. We are working on a cell line, but we have not yet come to conclusion. But possibly, or our hypothesis is that Fer.Phos is triggering some intracellular cell signaling pathway, and it is repairing beta chain. But we will come with more scientific evidence next time or some after we'll finish our work. Now, second, disturbed coagulation mechanism is also documented with Fer.Phos. You can find it in the Franz Vermeulen Concordance Mater Medica. We have referred Concordance Mater Medica of Franz Vermeulen, hemorrhage due to hyperemia. Now, for understanding of real meaning of this symptom, we can compare this with hemorrhagic infarction of lung in COVID cases. Let's see. In Concordant Mater Medica, they had Franz Vermeulen saying first stage of febrile disturbances and inflammation before exudate sets in, meaning we can use in suspected COVID case. Even the RT-PCR load, it is late. It is taking 2, 3, 4 days in India, but still we can start Fer.Phos as soon as we suspect. But it has a less role in secondary bacterial infection if occurred in patient. If the patient develops secondary bacterial infection, then Fer.Phos has a less role. Fer.Phos is a remedy when there is a purely viral infection. Purely viral infection. Then next, Franz Vermeulen Concordance Mater Medica, main characteristic is lack of characteristic. Meaning, HRCT shows extensive pneumonia, but patient has not cough or breathlessness at all. Here we can understand utility of Fer.Phos. Now, Franz Vermeulen, first stage of febrile disturbances, inflammation, fever, continued infectious pneumonia, hemorrhagic. Meaning, you can use this remedy in later stages of disease where viral pneumonia set in. Suppose patient come in delay in a viral stage, still you can use it. Only thing is that there should not be any bacterial infection. Franz Vermeulen, first stage of inflammation, congestion of lung, pleurisy, stitching, pain, aggravation, coughing, deep breathing. A chest pain was presenting feature and excellent recovery. I can see if time permits some cases where the chest pain was a presenting symptom and excellent recovery with Fer.Phos. Now, Franz Vermeulen, short, painful, dry cough and sore chest. Very common COVID-19 symptom. Now, how homeopathy see to happy hypoxia? Now, everybody understand that what is happy hypoxia? It is unique clinical condition occurring in COVID-19 cases. We had seen the cases coming by auto with SpO2 50 or much less than 50 without any breathlessness. This occur due to Hb carrying capacity of blood is reduced, leading to hypoxia. But CO2 return to lung in a bicarbonate form in 70%. So less or insignificant hypercapnia. Our central respiratory centers are sensitive to hypercapnia compared to hypoxia. Refer Guyton Physiology textbook. I repeat, our central respiratory centers are more sensitive to hypercapnia than hypoxia. So patient did not have or minor respiratory discomfort at the severe disease. This is the exact example of Boger's concept of negative general. Means lack of symptom where it must be present, then it becomes characteristic. So looking at a BBCR repertory, chest and lung, pneumonia, bronchitis, capillary, Fer.Phos is only remedy. Meaning ventilation is not a problem in this pneumonia, but perfusion is a problem. And Fer.Phos had this unique only remedy indicated in BBCR, which is in the case of atypical pneumonia. Now, COVID pneumonia is an atypical pneumonia. Means what? Rather than ventilation, perfusion is a problem due to microembolism. So this is what perceive of pathological similarity. This is our understanding of pathological similarity. Now, Fer.Phos is a specific remedy? Yes, there are many other remedies can come, but Fer.Phos is more specific or more many times indicated remedy. Now, novel coronavirus is a flu? No, it is much more than flu. It is vasculitis. It is an immune coagulation. Fer.Phos cover this pathology. We had seen this point. Happy hypoxia, we had covered this point. Now, what the parameter we had studied? How many patients need to be get indoor and outdoor? Then age of patient, then gender of patient, comorbidities, saturation or SpO2, fever, respiratory rate, lymphocyte count, CRP, ESR, loss of appetite, weakness, and outcome. Now let's study here. We have studied more OPD cases. We have what the cases we have prescribed more on OPD level than IPD level. Now these IPD cases were usually given by our people from modern medicine, physician, they are giving us call to treat their cases in their ICU. So these IPD cases were less. We had treated OPD because our basic project or the objective of our study is to reduce burden on IPD or hospital system. Now, summary, you can see our patient ratio, IPD patient 37% and OPD 62%. And those cases we had done OPD, they did not need to get into IPD. So our objective, first objective was that to reduce the burden on healthcare system. Now, if we had seen the age, we had seen the age frequency, we are working. We got the people, the patient more from middle age group, 40 to 60 age group. The percentage of patient age group 50-60 is the highest and followed by 40-50. The childhood. Now there is a burning question in India whether the third wave is going to affect children's. But as per our study, very few children we received. So we had not even included that age group in our study because very few cases, very few instances we got. That means, as we all know, that S2 receptors, which is the primary site of attachment of novel coronavirus to the lung, which is in a down regulation below age of 10 years or 11, 12 years, it is down regulated. So even children get infected, they develop only URTI and not a severe LRTI. Sometimes multi-inflammatory syndrome, but very rare. So we had not included our study shows younger age group is more affected. Now gender, male we are getting more, we get more male patient. This might be because in India, males are going out for the earning bread and butter compared to female. But the possible reasoning could be that they are going out, they are getting more exposure. So we got more male patient. 73% were male patient and 20% female patient. One surprising finding, it is not included in this paper or this document, that during the time of menses, the COVID symptoms suspended temporarily. This is our consistent finding. During time of menses, COVID symptoms get suspended temporarily, and this indicates this virus have something relation with hormonal receptors. Now comorbidities. We have come across diabetic cases, hypertensive, COPD, TB, and asthma. The hypertension was 17%, diabetic were 15%, TB was 4.4%. No patient with multiple comorbidities is not included in the study. Now, our issue of saturation. So below 85, we had not included in study, that we have one separate paper below 85, because in India, our law does not permit homeopath to treat people below 85 standalone as a homeopathy. And here we are using many cases OPD standalone homeopathy or only homeopathy. So we had not included in this paper below 85. So we had usually taken 95 and above. You can see this summary. The pattern of saturation in patient shown that the saturation is increased from 85 onwards as the follow. With follow-ups, you can see with follow-up their saturation SpO2 level. So Fer.Phos is surely, as per our statistical data, improving SpO2 or oxygen saturation. Now this graph, you can see there is a saturation is quite better improved with followed treatment. You can see compared to initial graphs, After treatment, we got a good result with increase in or improvement in saturation. Then fever. Now the fever of COVID, I will leave the graph and will come directly to the point. The pattern of fever shows that fever is decreasing from above 100 to normal temperature as treatment goes on. As treatment goes on, there is a increase, there is a improvement. So initially, you can see the people were having high degree of fever, and gradually with Fer.Phos, their fever settled down. So our first observation, second observation, and third observation. So the first 3 days, the fever was not responding that much, but subsequently the fever had improved. And the saturation, you can see the saturation is improving. Our SpO2 levels are improving. Now, our most important finding was the respiratory rate. Respiratory rate. Now, tachypnea. Tachypnea is a vital sign in this disease, respiratory disease like COVID. Like COVID, saturation become a saturation and respiratory rate RR. And now, why we stress lots on respiratory rate? Because respiratory rate is that clinical finding which is very easy for any healthcare provider to monitor. And tachycardia or respiratory rate shows that the patient, increase in respiratory rate shows that the patient is deteriorating, while improvement in respiratory rate, or if respiratory rate come down. So any clinician, any homeopath, even our students who are working with us, they can easily monitor the patient, and they give us feedback that with Fer.Phos, tachypnea is reducing. Now the reduction in tachypnea is very good finding, or very good finding, which delight the clinician that the patient is improving. You can see the graphical presentation, the tachypnea is significantly reduced. On the third observation, it is significantly reduced. Summary, the parameter is very crucial with respect to this disease, because this is pneumonia. The pattern of respiratory rate patient is shown that decreases from 38 to 14 onward as treatment progress. So 38, 40 was the usual when we begin the treatment, and the patient improved up till 14. Our statistic shows that there is a significant reduction in tachypnea. Now, this is another way we are presented our data, that the individual patient, how they shown the variation in respiratory rate. We had given lots of stress on RR, because RR is a marker which gives us idea that the patient is improving or deteriorating. And if patient deteriorate in India during such a bad time, it is very difficult to arrange especially ventilators and even oxygen beds in this pandemic time. So we monitor the RR, and you can see that there's a progressive improvement in RR. The graph clearly shows that respiratory rate is decreasing significantly for each and every patient along with its treatment. Each and every patient, you can see the graph. First one, blue line, when the patient comes to us. The second one during treatment, and third follow-up, the patient. The graph, you can see the graph, the respiratory rate from 37 it was reaching up to 40, and it had reduced to on an average 14. So you can see these three graphs. The first one when the patient comes for first time, the second one the first follow-up, and the third one second follow-up. The graph clearly shows that RR is decreasing significantly for each and every patient along with the treatment. Now lymphocyte count. This is again neutrophil lymphocyte ratio. See, the peoples in India are not that much affordable that we can go for HRCT of each and every patient. But the CBC is quite readily available in India. In even government hospital or government lab, it is free. So we had created one simple parameter, that lymphocyte percentage and neutrophil lymphocyte ratio. So the lymphocyte percentage is significantly improving. You can see this significantly after a second follow-up. The neutrophil, the lymphocyte concentration, percentage has significantly improved. The pattern of lymphocyte in patient shows that increasing from 30% to 49% onward. Now, neutrophil lymphocyte ratio, NL ratio, NLR, is a significant indicator in COVID-19 pandemic. Now, this why we prefer, why we take this parameter in our study, because readily available, you can easily perform, and cost effective. The costing, no recurrent follow-ups. Now, going for HRCT recurrently is first thing financially difficult, very difficult for patient. Second, the aspect of radiation or the risk of radiational injury increases with each and every exposure. So why to expose the patient to the radiation? That becomes a second concern. And third concern, readily availability, because now the diagnostic centers are full of patients. So the HRCT is not readily available in the time of pandemic. So we had used lymphocyte percentage as a marker to prove the effect of our remedy. Now CRP, as we know, C-reactive protein has become a paramount important. Now you can see the graph, how significantly CRP reduced. Now Fer.Phos is a remedy for inflammation, and CRP is inflammatory marker. The pattern of CRP has shown that decrease from 150 to below 25 as it goes on second follow-up only. So CRP reduces, it straightway means that the inflammation is reducing. Now this is the action of Fer.Phos. It is the remedy for inflammation, and the CRP significant reduction. You can see the graph. There is a significant reduction in CRP level after giving Fer.Phos. Second parameter we had used is the ESR. Again, cost effective, even though non-specific. But our study shows that the ESR is decreased from 125 to below 25 as the treatment progresses. No loss of appetite. Many people have this complaint during pandemic. Our study shows that, you can see the graph. Our study shows that the loss of appetite now decrease, means improvement in appetite. Finally, nil. Finally, nil, no complaint, appetite. So appetite improved, and the improvement in appetite is very crucial symptomatic relief for the patient. Symptomatic relief for the patient. Weakness. Now, how to diagnose? Now we had make a easy dictum. Now this is not a law. This is for our understanding dictum that weakness is the corona and corona is a weakness. When somebody come to our clinic, we used to ask, do you have weakness? If weakness, it could be corona. No weakness, no corona, that could be a really situation. So weakness is really, you can find it in each and every patient. However, I can say the hallmark of corona. Now this weakness, you can see the graph. The weakness had been improved. Now Fer.Phos can't say great weakness. Now severe to nil, severe to nil. Even post-COVID weakness, our patient, now that we had not included in this study, I had not prepared for with that, but our patient had not developed any post-COVID complication, even post-COVID weakness also. Then outcome. Now this many patients were cured, now shifted to other hospital, shifted to quarantine center. So small quantity of people shifted to quarantine center because of government rules, admitted to ICU. No patient cured, shifted and quarantine, 95% cured. Other patients shifted to ICU, very few. You can compare this. So very small need of, now this was our aim. This was our objective of our study, that reduce the burden on healthcare system. Now, why statistical test and this we will not enter now. And graphically, I can show you how our parameters had. I can see the mean plot, saturation and fever. Saturation is improving. You can here easily see saturation is improving and fever is reducing. Summary: saturation is significantly increasing, fever is significantly decreasing during treatment. Now RR, you can see the flat reduction, sharp reduction. Now the plot shows that respiratory rate is significantly decreased during a period of time. Now this ratio, lymphocyte count, CRP sharp reduction in CRP. Lymphocyte count, gradual increase in lymphocyte count, sharp reduction in ESR. So inflammation. See, Fer.Phos for inflammation. In Fer.Phos reduces inflammation. This graph is clearly showing the result. Now weakness. Summary, we had already discussed about loss of appetite and weakness. So this is the end of our report. Now, from this study, even though we had not included the post-COVID complications, but that will, if time permit, next time we can meet sometime. I can show you the post-COVID, because there is nothing to show, because last 1.5 years, our patient treated with Fer.Phos since the patient developed the complaint or first initial time, they do not develop any post-COVID complication, especially thrombosis. We have done that study with the D-dimer test. There is a significant reduction in D-dimer. Or even those people who had treated with the Fer.Phos, their D-dimer never increased during the course of illness. So post-COVID complications had been reduced. So this is something from my side. The Fer.Phos, first of all, I had clear you, I am not against individualization. I will repeat again, homeopathy is individualization, but this study, we have a focus on a single remedy, as we want to develop a tool for those people, especially our friends from modern medicine, physician, gynec, and other branches, and from Ayurveda. And even our objective is that even a healthcare provider, primary healthcare provider, where doctor is not available, like sister, ASHA worker in India, they can use this remedy and reduce the burden on healthcare system. So this was from my side, our objective, and I felt we have significantly achieved our objective as per statistics. So I will stop my presentation over here. Now this is time for discussion. You can ask me any queries if you are having.
It's very nice presentation, Doctor. Congratulations, because I think a remarkable one is the observation that during the menstrual period, the symptoms are suspended. It's a nice observation. It is quite novel in the study of regarding on the COVID. Then about you have almost connected all aspects of this COVID, as well as the symptoms and different criteria. Especially the statistical work is excellent, I think. Everyone can follow, and I think you can have more classes on these aspects, how to make these statistics well. Then about the applicant of COVID, this Fer.Phos, I think the nature's law has got its own elasticity. We always depends on symptoms, so different schools are there. Of course, the Hahnemann method is there. Then as time progresses, Dr. Richard Hughes developed another method, more depending on the pathological aspects. Then in fact, there is also some similarities there. Moreover, when we use the medicines, especially the medicines like inert medicines like Fer.Phos, the 30th potency, it can produce symptoms more of the central symptoms. That is more important. That is why you have, I think, it's a secret of your achievement here in this aspect. So we can definitely say it is not at all against homeopathy. It is also as a part of homeopathy, and we all know that as the time progresses, different types of methods and inventions and thoughts will come on. Just like the Ayurveda, where thousands of years old, there are different textbooks, and medicines and preparers are totally different according to their different sanhidas. Just like that. But Ayurveda is Ayurveda. Just like homeopathy is homeopathy. So it's a time for discussions. Those who are interested to participate discussion and go to the participant list and raise the hand. I think Dr. Rajendra came on first. Raise the hand, Dr. Please, Dr. Rajendra. Unmute yourself.
Sir, good evening. Good evening. Very beautiful presentation. Even I found Fer.Phos highly effective. The first stage as a just take in parallel with Aconite. in most of the upper respiratory, within 24 hours, I found it is more useful. And as you rightly said, Fer.Phos as a first stage of inflammatory marker, I think it is giving good results, sir. Whether the patient is diagnosed as COVID positive or not, but Fer.Phos 30 seems to be indicated, sir. It was a very nice presentation, which I wanted to just share my experience also. As far I am from Belgaum, Dr. R.C. Ranade from Belgaum.
Okay.
Okay. Now, the PNS group.
So, sir, the presentation was excellent. But it is a very sample trial. According to research way, it was performed. I appreciate you, but that Fer.Phos was using for fever, not only for the COVID. It was long back. Even I was using for 6x, not to the 30th. 6x I was using since from my practice itself. The first stage of the any fever, I usually used the Fer.Phos 6x in divided doses. That it was having very good result, irrespective of whether it is the disease, that it will give a very good result. So anyway, it is a good trial, that it is a sample study, but even it is a small study, but it was efficient and it is leading to some light into the subject. Thank you very much. And thank you very much for the giving me an opportunity. Thank you, one and all. Bye.
Yes, sir. Well
Good
said.
night.
For the statistical studies are very important and it is nicely executed on. Now, Dr. Lokmani Gupta, please. Please unmute Dr. Lokmani Gupta. Okay, sir.
Hello.
Yeah, that's audible.
Thank you, sir. Thanks for giving me an opportunity. Very nice and scientific presentation of the work done by respected Dr. Santosh. I congratulate for his presentation. Sir, my two questions are that please repeat the Allen ratio, lymphocytic and neutrophil ratio, which you told very important to diagnose the stage-wise improvement. Please repeat Allen ratio. And sir, Fer.Phos and belladonna are the two medicines very important for any type of inflammations, itis. Belladonna, homeopathic medicine, and Fer.Phos, usually a biochemic medicine, which I too use in 6x, but you are telling for 30. Please give the preference or the difference, what you felt to prefer and use Fer.Phos instead of belladonna. Please.
Yeah. I will again share my screen.
Okay.
See, this study actually I had not done alone. This is done with my two best friends, Dr. Makaran Athavale and Dr. Sagar Rahalkar. We three people are working together. So I should tell you all that because both of these my friends, we are working as a team, and we want to develop the study as easy as possible to be implemented. So we have taken neutrophil lymphocyte ratio. I will just go to that point. As we know, this is a viral disease. Now, in viral disease, virus suppress lymphocyte and neutrophil percentage increases in the initial state, of viremia, as regarding COVID. Now, yeah, this is the table. Now, first stage of COVID infection, first week is a viral phase and second week is inflammatory phase. In the first week, what happened? The more number of virus or viral load is more suppression of lymphocyte. Less viral load, less suppression of lymphocyte. And neutrophil are being a first line of defense. More the viral load, more increase in neutrophil percent compared to lymphocyte. So lymphopenia indicates higher viral load. Now, when I was discussing with Dr. Makran and Dr. Sagar, the idea come in our mind is that we should have some idea for understanding the viral load. Now, RT-PCR is giving viral load, which is very costly. It is not possible to do RT-PCR viral load. So we want to develop one simple technique. So through which we can understand what is happening with the viral load. What is happening with viral load. That's why we had concentrated on lymphocyte count and neutrophil lymphocyte ratio. So now if you look in this graph, there is a gradual improvement in a lymphocyte count. Means the first stage of viremia or first week of infection where viral load does not go too high, when we applied Fer.Phos. This had been confirmed by improvement in lymphocyte count, And if viral first week of infection, viral load does not go too high, then second week, there are chances of cytokinin storm are less. So by checking lymphocyte count in a first week after application of Fer.Phos and seeing improvement in a lymphocyte count, we come to the conclusion that these patients are not landing in cytokinin storm. So instead of checking IL-6 and IL-3, which are interleukin-6 and interleukin-3, which is costly investigation, we concentrated on lymphocyte count. So this is a kind of way we applied a cost effectively understanding the behavior of virus in our patient. And I will come to the graphical presentation. So I hope you understand why we stress on lymphocyte count. Now here, see, this one CRP rapid reduction. ESR rapid reduction and gradual improvement in lymphocyte count. Means if you apply Fer.Phos in the first week, it does not allow the viremia. To go to extreme that it will precipitate cytokinin storm. First thing. Second thing, we prefer 30C not as a biochemical because this is a viral disease. Now, virus is a more dynamic form. Means what? What we are expecting that, see, antibody response is going to come after 12 days. So when there is a stimulation, antibodies are not coming at all before 12 days. So what was our idea? That reactive lymphocytic response. We want to raise T cell mediated immunity. And this T mediated immunity, to develop this T cell mediated immunity, we have to use the dynamic, means 30 or higher dilutions rather than going for biochemic. See, going for a biochemic will reduce inflammation definitely, but whether it can trigger T cell mediated immunity and it will reduce or it will limit the viremia is, we, as per our knowledge, was really tough issue. So why we go for 30, not 200 or 1M? Because we want to develop a general tool, universal tool. So if we entered into susceptibility point and individualization, then again our studies objective was missing. Our objective to develop a general tool. So we don't want too high, don't want too low, and still we want a dynamic form. Because why dynamic or why potentized form? Because we want to trigger T cell mediated immunity. That's why we don't prefer biochemic form. Our aim was not only to reduce inflammation like steroid. What does steroid does? Reduce inflammation. This is not the our only idea, but we want to utilize homeopathy for reducing variability. Okay, that was the reason why we go for 30.
Yes, that's a nice explanation by doctor. That is why we always use a 30th potency as a preventive medicine, so that everyone will develop symptoms. So we can more depend upon the physiological symptoms or the superficial symptoms are there. It's a nice explanation. Now, Dr. Shaji Kudiyat, what is your opinion, Dr. Shaji Kudiyat?
I came little late to be asking sorry for that. So in the initial portion, I was not able to attend to it. Anyway, Fer.Phos and its indications and its application in the corona. Is this you are doing as an add-on therapy or individual treatment with the Fer.Phos?
Yeah. This study is purely standalone. Only those people who were in IPD cases, 37% cases from our presentation were from IPD. There we had given as an add-on, but remaining 63% cases, they were standalone. They were standalone. The OPD we had done is a standalone, even not a paracetamol, even not use a paracetamol. And those 37 cases in our study from the ICU or hospital, they were hospitalized means ICU. They were landed in ICU, and our physician or friend from modern medicine given us call to treat this. Definitely there was an add-on. But our OPD cases were standalone. That much standalone, we had not used a paracetamol.
But the IPD cases were using paracetamol and other medicines.
They were 37%. Those were from IPD. They were from ICU only. And there we are
meaning they were taking bronchodilators.
Everything.
Okay. So that one important point we need to note here, because the statistics we notice here is also connected to the influence from other medicines, isn't it?
One point I want to add that even the patient is on a steroid, still homeopathy work. This is what we had learned. The patient is already on steroid, immunosuppression. Even some patients were received tocilizumab, immunosuppressant, and still they responded to Fer.Phos. So means how homeopathy work. Now that point, what is my idea? It trigger homeostasis. Now homeostasis, as per physiology definition, body's tendency to keep internal environment as it is, and this is not only immunity but a huge mechanism. So here, even though using the steroid, still homeopathy can work. Many people are afraid that the patient is already put on steroid or they are given tocilizumab. Still, I can say that homeopathy works because it acts on homeostasis, not on immune system only. Immune system is a part of huge homeostatic mechanisms.
Did you have had you done any comparative study with other patients without Fer.Phos?
Actually, that was the burning question. We were applied to one institute for a study, and for one, we can say we had some authority. We went to some authority, that would be right word, and they asked us shockingly, "Are you going to do placebo control study?" So how it could be possible in the pandemic, deadly disease, doing a placebo control study is impossible. People will shoot us. So they rejected our study proposal. So we were not get enough finance from any authorities. Then we had created one paper using the published data, our data with published data, but that is not right now not available with me. So we had used control as a published data from modern medicine, from pulmonology journal. They had published the data, but that paper is right now not available with me. But sometime I will give you that presentation also, where we had made the comparison, and I can say assured that we are really better than modern medicine, at least in this case of pandemic. Now, this could be a bold statement. Sorry, I don't want to hurt any people from modern medicine. This is not from my mindset, but this is from our data analysis. But right now, not available with me, so better not to speak.
Yes, a lot of medicine. We have a lot of medicine. That's the peculiarity. This the world must listen. We have so many medicines. No limited homeopathy.
I have one more question. In your personal observation, did you made any observation during your visit to the IPDs that the patients who are not using homeopathic medicine developed any severe complications like this fungal black fungus like that? Did you observe any such observation?
Yes, sir. I explained it during my presentation time. That is our another paper right now not available because I don't got enough time to prepare or available make it paper available. My hard disk is not in the clinic. That is at a home, so I'm not able to give you that presentation. But with homeopathy, if you treat from the beginning, if you stand on homeopathy or add on homeopathy, stand alone homeopathy or add on with modern medicine, our study shows that the incidence of post-COVID complication is almost nil, almost nil.
Okay, that's all from me. Thank you. Dr. Abraham Vaidyan is there to ask. a question.
Yes, Dr. Abraham Vaidyan. Please, doctor.
Good evening to all. Thank you very much, the authorities, for giving me a chance to ask questions. First of all, I'm congratulating the doctor. I don't know. I not participated from the first part. Actually, I don't know. I don't know his name. Anyway,
Dr. Santosh.
Dr. Santosh. Anyway, it is a scientific presentation. Actually, we lost such presentation. He, with the data, he analyzed everything. Actually, this Fer.Phos. I also done so many COVID case treatment given to COVID cases. I use many medicines. Well, recently, 2 months back, I heard about this Fer.Phos. And I was using only 3x potency. Even with the 3x potency, I got a very marvelous result. I gained marvelous result. But today, I heard from this doctor that 30 is the effective potency. I appreciate you, and it will be a very encouraging. It is an encouraging space for the doctors who are treating COVID cases. And so, thank you, doctor, very much from me and from for the all homeopathic doctors who are treating COVID cases. Thank you very much.
Dr. Kamal Shah, are you there?
Yes, I'm here.
Yes, please. Special welcome, doctor.
Okay. First of all, I would like to congratulate Dr. Santosh on his report here tonight, and I agree with him totally on the use of Fer.Phos 30C, because from my experience here, although I'm not treating any COVID patient as much as you are, Fer.Phos seems to increase the oxygen level in the patients and making them, their respiration better, and the cough stops almost instantly after giving Fer.Phos. That's from my experience here in Malaysia. Thank you, Dr. Manoj.
Okay, very nice observation. Then, doctor, what about the post-COVID conditions and the outcome of after Fer.Phos?
See, our study, those people we had treated since beginning, they do not develop any post-COVID complication. But for those people who were not initially our patient, they had visited to our clinic as a post-COVID patient. Now here we had used Fer.Phos only in one condition, that is weakness. Persistent weakness, even 3 months patient are complaining of a weakness, and we had given them Fer.Phos for post-COVID weakness, and that worked best. But other post-COVID complication, now I had treated Guillain-Barré syndrome 12 cases post-COVID. They were treated with different remedies like sepia, gelsemium, and other remedies. But if we limit our today's topic to the Fer.Phos, Fer.Phos can be used as a post-COVID for the weakness after corona. And see that weakness after corona limit people for going to their job, earning their bread and butter. So if even we can cut off that weakness, and if we improve their physical stamina or health, that is also a good job with the Fer.Phos. So I'm satisfied up till that point. And I individualize the cases with that particular individualized remedies.
What is the situation of Maharashtra as of now?
Right now, my own district is going through a bad time. Kolhapur district is going through a bad time. 2-3 districts are going to bad time, but the Mumbai, Pune has already reduced the second wave. Now they are doing good. Now, just I today read a paper of ICMR. More than 60% people develop antibodies in their ICMR study. So hopefully the second wave will be. This will be the end of pandemic. And I pray to the God that there will be no third wave. Please, please. Now this is enough. Now I hope the like Spanish flu. If we compare this pandemic with the Spanish flu, because homeopathy has great data from Spanish flu. So after 2 years or 2 waves, the Spanish flu ended. So we hope the COVID follow the same pattern as the Spanish flu, hopefully. And as we had done great in the Spanish flu, we had done great in COVID also.
And how is the status of distribution of homeopathic prophylaxis in Maharashtra?
See, prophylaxis, that was done great work by many people like Dr. Jaswant Patil, Dr. Ajit Kulkarni, many people, many organizations had done with arsenicum album. I myself never enter into prophylaxis because prophylaxis has many parameters. My another study going on is the using humidifier as a prophylaxis. So I never enter into homeopathic prophylaxis part because there are too many variables like distance, mask, direction, humidity, direction of air, humidity. So to study a prophylaxis is a really tough job because too many variables are there. So I myself never enter into such a complicated task, which is even the vaccine studies are not efficient or not complete. I can say the vaccine studies are not complete. Even I had read the study of Pfizer, study of Moderna. It is not to the mark yet. They will improve, but not yet because of too many variables, because of mutations, new variants are coming, then so many. So I did never enter into a prophylaxis part of view. So I felt as a clinician, my job is to treat rather than entering into such a, too many variables. So tough to statistically prove anything as per my point.
Whether I can add something?
Yes, sir.
For the weakness, ginseng is one of the best medicine, giving mother tincture, and alfalfa and that Avaina Sadiva tincture also will give immediate relief for to the weakness after COVID. That is my experience. I am contributing here.
I agree with you, sir. There are homeopathy is a huge. So there are many remedies.
I wish to ask a question to Dr. Kamal Shah from Malaysia. You came here, Dr. Kamal, to ask maybe a question, but I wish to ask you also, what is the situation of COVID and the situation in Malaysia now? Dr. Kamal Shah.
Okay, thank you, Dr. Saji. The situation here in Malaysia is very funny, the government insisted on having what we call an emergency. They call for an emergency 2 months back, and they said by imposing this emergency situation in Malaysia, the COVID cases will drop down. But it has not been that. In fact, the COVID situation in Malaysia is getting from bad to worse in Malaysia, increasing every day. And now we are reaching over 13,000 cases per day in such a small country like us. And it worries us. So I don't think they are going anywhere with the vaccination and all, because we have a lot of reports of post-vaccination problems involving patients. And another thing is also a question to Dr. Santosh and also to you, Dr. Saji. Do you think we can use Fer.Phos to give to our patients before going for a swab test, for the PCR test? Do you think it's advisable to do that?
Yes, sir. This is the thing. What a beauty of homeopathy. We don't need a nosological diagnosis. As soon as we suspect COVID, because weakness is the first symptom to come, as soon as you suspect, start Fer.Phos. It is not going to harm, and this is the right strategy, because result of RT-PCR in India are 4 days, 5 days later. Till that, the patient is almost covered with the Fer.Phos. So going as soon as you suspect is the best policy.
Okay, thank you.
Yes, the second condition, the natural science should have the provision for provision. without having any fresh disease, we can treat. That's a simple homeopathy. Very good suggestion, doctor. Thank you, Dr. Kamal Shah. I am inviting Dr. Hubert Silva to ask questions. Please. Hubert.
Hello.
Yes.
Hello. Can you hear me?
Yes. Of course.
Doctor, congratulations. You have done a very good statistical study of. I think that it is better we should study all the medicines like this manner. Then we can know that how much it is affecting and how much it can change the bodily changes and everything. We can study it in a statistical way. It is. I think that it should be used in to study every medicine. But I want to ask one question is that, are you taking any preventive medicine?
No, sir. I'm not taking any preventive medicine and I am not taken the vaccine. I'm not entering into a controversial topic of vaccine. But what is my personal observation is that the COVID is spreading more rapidly indoor, and outdoor the transmission chances are very less. And my clinic is designed by architect who had make it plenty of airflow, natural airflow and natural sunlight during the daytime. So I myself remain a much more safe environment, and I examine the patient. I really don't know what is the issue, but my blood group is also ORH positive, and O peoples are less susceptible to the COVID. So I had not went, because I know if see the prophylaxis is really a topic which is very controversial. So better not to enter into it. I had not taken anything, and I'm not going to take vaccine. If I get infected, I will take a Fer.Phos because I have the cure. So why I should worry about the prophylaxis?
Do you think that virus know that O positive should not attack O positive people? Huh? This is the first time I am hearing such a.
Yes, sir. Please pardon. I don't understand. Pardon, sir.
This is the first time I am hearing that O positive, blood group are not affected by with COVID.
Open air.
No, COVID
Blood
is
group,
not
yeah,
affecting.
It is preference. See, A positive had a highest risk of developing severe disease. ORH positive has a lowest risk or lowest susceptibility. Now the susceptibility concept of Hahnemann, now modern medicine is implementing. They are saying that their statistic is showing ORH positive are very less susceptible. A positive is highly susceptible. This is published data. I'm not telling from my side. This is published research paper.
Okay, thank you.
Okay, and about the importance of fresh air and sunlight is discussed by Hahnemann in the article of Front of Health. Everyone can know in the lesser writings of Hahnemann is there. Now I invite Dr. Logmani Gupta to say the vote of thanks. Okay, please unmute Dr. Logmani Gupta.
So Manoj, can I have Dr. Santosh address or contact number, please?
Yes, my contact number is 9422
Yeah.
9422 42
Yeah.
4650.
Thank you, sir. 9422 42 4650.
4650. You can write me Ranade Santosh, RANADE SANTOSH @gmail.com. @gmail.com. I can write my number in the chat also. So
Yeah,
those who want to have my number, they can take it from chat.
Okay.
Thank you, sir.
Hello. Hello.
Yes, audible, please.
Yes.
Timely good wishes to all the participants all over the globe today. It's my pleasure to give thanks to such a nice speaker for a current problem who did all his work scientifically and presented the work in scientific way. What is needed in homeopathy in present time to bring it on to the #1 level. The only thing we are in lacuna presentation of our work. So I congratulate Dr. Ranade very well, and I appreciate Dr. Silva's opinion that such studies should be done on every drug. I appreciate the question raised by Dr. Shaji Kudiyal sir that how much patients you treated indoor with what was the control. Control patient is very essential to prove our thing scientifically. So I appreciate the doctor's feeling. I appreciate all of you and very nice session conducted by Dr. Manoj sir, by yourself. And once again, I thank very much to all of you for giving me an opportunity to present. Secondly, I'm very much thankful to Dr. Kamal Shahji for giving an opinion of Malaysia's COVID position. Sir, in 3-4 days back, when you was going to perform white rally there, so and Dr. Shaji Kudiyal sir advised you to consult those NGOs and to place there our opinion as a homeopathic doctor to help the COVID patients. Sir, what was the position? What was the situation of that? Please do accordingly to bring homeopathy up in this crucial time. Thanks a lot.
Okay. Well, that marks the end of today's session, English session. Now, those who are interested to participate in the Malayalam session can continue. Others can do. Yes, now it's over to Dr. Bindraj. Thank you.
Thank you, Dr. Manoj. Am I audible?
Yes.
Yes, yes.